Hi. Hi, everyone. Welcome to the Public Health and Psychology Division 1. We have 4 presentations today in this division, and at the end of each presentation, we'll be taking questions from judges and then the audience. You may ask your questions through the chat or use the Zoom raise hand function and then wait to be called on. To make this as engaging as possible, it would be great if all of us could turn on our cameras today but stay muted throughout the presentation. Before we begin the presentations, can the judges briefly introduce themselves and mention their research field?
Yeah, I can go first. My name is Jordan Smith. I am a master's student at Baylor University. So I'm about to graduate with my master's in public health, concentrating in epidemiology. I've done some research so far on physical activity in general, and then I'm also a research assistant at Baylor Scott and White. And there I do research about mental health for firefighters and veterans. And in the long run, I want to do firefighter and cancer incidence research. So that's me.
Hi, and I'm Becca Summerall. I'm in the same cohort as Jordan, so we're both about to graduate with the same degree, except my concentration is in community health instead of epidemiology. And my research really focuses around something I call the disability triad. So it's disability status, physical activity, and mental health, and how all three of those things play off of each other.
Thank you. We're so glad to have both of you here today. So our first presentation is by Brandon, Hannah, Madeline, Celine, and Jonathan from Baylor University. You already shared your screen and you can begin when you're ready.
Okay, good morning, everyone. We want to thank you for allowing us to present our research with you today. This was a self-guided research project that we conducted through the 2020 CMO internship this past summer and fall semester with the help of Baylor alumni and Baylor professors. So today we will be presenting a predictive model assessing external suicide risk factors at the county level. Moving on to introductions, I am Hannah League. I graduated in December of 2020 with a BA in Sociology and Health.
And I'm Madeline Olivas. I'm a biology major with a minor in business administration.
Hello, my name is Brandon Cunningham. I'm a junior and I have a major in cell molecular biology and a minor in business administration and biochemistry.
I'm Jonathan Wu. I'm a senior French major with a chemistry minor.
I'm Selena Rakiti. I'm a junior biology major with a concentration in global health.
So moving on to our research question, we knew we wanted to base our project off of something regarding mental health, so we eventually landed on the topic of suicide. And firstly, I just want to acknowledge the weight of this topic, and we hope that we are able to act sensitively as we guide you through our research today. So collectively, our research question was, which individuals are the most at risk for completing suicide? What impact does the availability of mental health care have on suicide rates? And based on available data, which prevalent external suicide risk factors contribute the most to the completion of suicide across individual counties in the United States? Moving into our intro, as it currently stands in the United States, suicide occurs at a rate of 10.8 per 100,000 individuals and is the 11th leading cause of death. So this certainly merits the prioritization of suicide research and specifically suicide care prevention allocation. Suicide rates have steadily risen in the past 20 years, and in the past 15 years, researchers have worked to respond to why the rates have been rising as they have, and identifying those most at risk for suicide and what is impacting the rising rates that we are seeing in relation to suicide. Our project was certainly prompted in response to the COVID-19 pandemic, as suicide rates are predicted to spike due to factors such as financial strain and social isolation, which are some of the external suicide risk factors that we'll be discussing during our presentation that we looked into in our research. Sorry about my dogs in the background. This always happens, forgive me. So we really saw the need to expand the term of external suicide risk factors. And from that, we sort of birthed the idea of a prevention model in regard to suicide risk factors. So this would essentially target groups in need, those reported most at risk for completing suicide in relation to demographics. So through that model, we would be able to target the populations most closely linked to the act of suicide. And through our research, by taking county level data throughout the United States, we were able to examine geographically where prevention resources are the most needed, and that would then produce care, prevention, and resources allocation. So we'll explain more what we mean about external suicide risk factors in our prevention model, but now we're going to move into some more background relating to economics behind suicide.
Hi again, guys. So I'm going to talk a little bit about the economics behind suicide. Suicide is often framed as a social problem, and it is a social problem. The suicide prevention that we were researching is an effort to preserve human life. However, something interesting happened while we were researching suicide this summer. What kept on coming up as we're researching it is the economic impact of suicide, and it has significant economic implications. So the cost of suicide can really be broken down into two camps. There's the direct cost, which is like ambulance, funeral preparations, physician costs, stuff like that. And then there's indirect costs, which is a loss of productivity. And loss of productivity basically is related to the future earnings that the person who completed suicide was supposed to earn. Okay, so now that you guys kind of know what that cost number means, the average cost of one completed suicide in the US is $1,329,553, which sounds insane. When I read that the first time, I was shocked. And 97% of that cost is the loss of productivity, which I just explained. And then 3% of that cost is the direct cost associated with medical treatment. And the national cost for suicide and suicide attempts in a one-year span in the US is $93.5 billion, which is also insane. So while human life is invaluable, the financial burden on American society cannot be underplayed. So when we go into looking at preventative models, I think that something to be considered also is the cost benefit analysis of suicide prevention.
Yeah, so now we're going to get into some of the external suicide risk factors. These were all the independent variables that we plugged into our program. And our dependent variable was crude rate of suicides per 100,000 people in a county. So as you can see, we have median household income, mental health care providers, different races, age, percent rural, and sex. Unfortunately, we had to get rid of, sorry if there's noise in the background. We had to get rid of some of our variables because of collinearity between our VIFs. So if we go to the next slide, we're going to see a little bit more. Okay, so we're going to get into some of the methods and how we actually got these statistics. So we use the statistical package for the social sciences, SPSS. And unfortunately, of the 3,000 counties, only 600 or about 600 were able to be analyzed. And that's due to suicides being suppressed in counties that have less than 9 per year. Also, with some of our other data points, we were missing some data for counties. So we had to take out a lot of counties because of that. Again, those are independent variables that we're going to be analyzing. And we put this in a multiple linear regression model. So I'm going to be talking a little bit about the data that we got. So here are results. We put all of these, as I said, in a multiple linear regressional model. And we got an adjusted R-square of 0.71 with a p-value of less than 0 with 3 decimal points. So our model was very predictive of suicides that were occurring in 2018 by counties. And something that's really interesting, if you take a look at the standardized coefficients beta, you can see the main independent variables that played into our overall program. So we could see that percent rural had one of the biggest impacts on suicide rate by county. And that was a positive correlation. So as percent rural increases, crude rate of suicide by 100,000 increases as well. And some more interesting ones were number of mental health providers, as we expect, as number of mental health providers decreases, suicides we saw increased. Furthermore, one of the other bigger factors was median household income. And that was also an inverse relationship. As the median household income for a county decreases, we see an increase in suicides. So we put all of these independent variables into our model, and that is the R-square we got out, which was fairly predictive of suicides by county. So the next slide. So a very interesting part of our project that came out of this was some outliers. So what we're really interested in are the county outliers that we identified with residuals. So although our program was really good at predicting around 500 counties, or probably more, like 400 or 530 counties, there were a few counties that were outliers. And I included two on this screen, but there's many more. So we took a residual by taking the predicted crude rate suicides per 100,000 and subtracted that from the observed crude rate of suicides per 100,000. So we did this, and we saw that for Glia, Arizona, there were significantly more suicides than the model predicted. So we had a residual of 5.996. So for future research, we're really interested in why these counties had so many more suicides than our model actually predicted. Another interesting one, Sumter, Florida, had significantly fewer suicides than we predicted. So future research can definitely be, why did these counties perform so much better or so much worse than our model predicted?
Yeah, so just to kind of wrap up our study, I think it's important to acknowledge some of the limitations that we had inherent to our model. And so, as Brandon mentioned earlier, only 557 of the 3,142 counties in the United States were able to be analyzed due to the suppression and unreliability of certain counties. So yeah, if there were less than 10 suicides in a given county in the year that we took our data from, the numbers were suppressed. And also, if the county had a population of less than 10,000, the number was also suppressed as well, as the suicide rate was given per 100,000 residents. And as always, with these kind of data-based studies, we're looking at correlation versus causation. So we can't really say anything besides the variables have the relationships we found with suicide rate. And furthermore, we did not have access to the demographics of each individual suicide. So it's very difficult to say that the relationships we found are directly related to the suicides. And then as always, like, we don't claim that our model is comprehensive at all. Yeah, there are always more variables that we can input, and the proxies that we took might not necessarily represent them in the best fashion. And so at the end of the day, we found that our model highlighted that external risk factors were statistically significant. And so we're hoping that further research can be conducted to extend to better mental health outcomes and suicide prevention strategies. And there's a lot of stuff that we could go with future research. We could look at developing our current model, including more variables, accessing more data. We could kind of look closer at certain things like the outliers. We can look at why specific variables had the relationships they did with suicide rate. And then we also found that standardizing the data sets, especially at the county level, would be very beneficial for mental health research overall. Yeah.
Thank you for that presentation. Judges, do you have any questions?
I do. So did you, just really quickly, did you perform like a literature review? You looked over some of the literature before you got into this project, I'm sure. Were you able to identify any other similar research projects or anybody that had similar results to what you found? Was that something you expected, or were these numbers sort of new to you?
So when looking at the demographics that we researched, we found that our results were consistent with other suicide research analyses in literature, that is currently existing in terms of, so we found that men are the most risk for suicide, which has been proven. And it was, correct me if I'm wrong, Brandon, what were the demographics most at risk for committing suicide? I think ages 40 and above, those connected to rurality. So that was definitely consistent in terms of our demographics with existing literature, but we didn't see anything necessarily close to the predictive model that we are presenting. Our model is not established yet. It is more of a work in progress, but we didn't see something necessarily, a tool that you could use to really identify the populations most in need of prevention allocation and resources, especially geographically. As we looked at the county level data, we're able to see the area specifically which would benefit for more resources regarding to suicide and more care prevention strategies.
Great, thank you.
If I could add one thing on that really quick, because I know we're running out of time. We're just really focused with this model on making it even better and including more years into it, so that maybe counties in the future can look at this data and incorporate into their spending plan and say, okay, we need better allocation in this demographic other than this one because of suicide. So we're really focused on developing this program for the future and having counties use it in the United States.
Thank you. Are there any more questions from the judges?
Yes, I do have a question. So great job on everything, guys. Y'all did great. I have a question about the statistical analysis. So I noticed that you guys included 2 different races in your analysis. What was your reasoning behind that? Why did you include those specific 2? Were there others you considered? Like, what did that look like?
Yeah, so Jonathan, can you click back to that slide with the huge graph? We included those specific races because when I was running this, or when we were running the statistical analysis, we considered all the VIF scores, and it was really interesting. We weren't able to include it on this PowerPoint just because of time restraints, but there were many races that actually had very, or the VIF scores were impacting each other greatly. So that's why we had to exclude many. And we kept Black or African American, American Indian, because reservations generally have much higher suicide rates, as you all probably know. So we wanted to include that. Also, there were many other races we wanted to include, but the VIFs were competing. And sorry, I failed to mention that when we were presenting, but that's the reason. I hope that makes sense.
Yeah, absolutely. Thank you. Appreciate it.
Thank you for a great presentation. And unfortunately, we've run out of time for this section. So we'll be moving on to the next presentation, which is by Sarah from Baylor University. Before we begin, judges, do you need more time to finish writing your feedback? So Sarah, you can share your screen and begin whenever you're ready.
Sorry, give me 1 second. It's asking how to do it real quick. Sorry, I just got my computer like fixed yesterday, so it's like wanting to access all this stuff. I'm not sure why. I'm so sorry. Let me try. Of course, this has to happen. Oh, never mind. We're all good. Okay, can everybody see everything okay?
Yes.
Okay. Give me 1 second. Okay. So hi, my name is Sarah Mazda, and I am a junior at Baylor, and I have a major in psychology, and I'm getting my minor in sociology. And this study was also done with Austin Scott and Abby Bayhue, but I'm the one presenting. And this was done under the supervision of Dr. Sean Latondres in a research methods class that I was in last semester. And so we're going to be actually looking at the association between empathy and perceptions of substance users among religious college students. So first I want to give a little brief overview into the world and how this impacts these individuals. So first off, substance use disorder and addiction in general affects millions of people across the United States and millions of people across the world. It impacts people from lower economic status, people from higher economic status, people of all races, people of all genders, people of all sexual orientations. It does not discriminate. So this is a very large public health concern, and it impacts people and their families and their loved ones in many huge ways. So because of that, we're going to look into how people's perceptions and attitudes towards these individuals impact their life. So first of all, the general public viewed people with substance use disorder more unfavorably, and they kept a greater social distance. So this is a big problem because if people keep their social distance and they have a greater negative view towards people who have substance use disorder, they're unable to get to know them as a person and unable to make them feel like they're actually worth something, because that's a big problem, is that negative perceptions and actions induce these individuals to feel worthless, dehumanized, and they feel unable to succeed. And in a society that makes them feel that way, it's really hard to come and step over that stepping stone of trying to get, hey, I want to get help. Hey, I want to go to rehab. I want to get clean and sober. And it's hard to do that whenever the society is constantly telling you that you're not worth anything. And so because of that, we're going to look at that higher levels of empathy can result in lower amounts of negative attitudes and behavior. So this is really important because college students' empathy levels in the United States are actually decreasing. And so we're trying to figure out, how can we make these go up? How can this influence people who are suffering with substance use disorder? And actually the general attitudes of undergraduate college students towards those who misuse substances become less negative as an increase of exposure and understanding are implemented. And it's when one feels empathy and compassion towards a stigmatized group, there's an increase in positive behavior and actions towards that group. And this can make a large impact on someone's life. Like if someone is just given a smile and is just given like a hug and telling them that, you're not to be afraid of, you're not to be seen as worthless, you're not to be seen, you are a worthy human being. That can make a large impact in someone's life, and that can make them think, hey, I want to be a better person for myself and my family. And it can make a really large impact. And because of this, there's other research that says that religiousness is associated with higher empathetic concern in both self-report measures and observations. So the research question that we are looking at is, are higher levels of empathy associated with lower levels of negative/stigmatized attitudes towards substance users among self-identified college students? So in this, we hypothesize that increases in empathy levels will predict a decrease in negative attitudes towards people who misuse substances among religious college students. So our methods for this research study was, we did use convenient sampling through an online survey system. And we did do this because of resources and time allocated, and we did use it through Qualtrics through asking a couple different surveys. So from that, we have 90 participants, and it was 63 women, 25 men, and 2 prefer not to say. So there was actually more than 90 participants. There was around 150, but we surveyed only religious and spiritual students because we wanted to look at that specific population. So we just limited it to 90 participants. And we also had a majority of our participants are Caucasian and white. And we also have 14.4% Hispanic, 17.8% African American Black, 4.4% East Asian, 1.1% Hawaiian Native Pacific Islander, and 6.7% as other. And as other, I mean someone as biracial was a large percentage as well. And we also had 19 freshmen, 21 sophomores, 34 juniors, and 16 seniors. So we also looked at religious affiliation. And because of that, like I said, we only surveyed undergraduate students who identified as religious or spiritual. So majority of this was 67.8% Protestant, but we also had a large percent who were Catholic. And then we had a small percentage, 1.1% Muslim, and 1.1% Buddhist, and 1.1% as other. And the majority of those other percentages were people who just identified as spiritual rather than identifying with a certain specific organized religion. So the measures that we actually used to look at this was the Toronto Empathy Scale by Spring et al. In 2009, and Stigma of Drug Users Scale from Palomar et al. In 2011. So the Toronto Empathy Scale does have strong convergent validity with high positive correlation towards the affective empathy component of empathetic concern and with the cognitive empathy component of perspective taking. In the Stigma of Drug Users Scale, conveys strong convergent validity through a negative correlation between levels of exposure to those who misuse substances and negative stigmatization. So through our analysis, our independent variable was looking at levels of self-reported empathy, and our dependent variable was looking at the negative attitudes towards substance users and how those can be affected by the self-reported empathy levels. So we did do a Pearson's R, and we did do a linear bivariate regression. So our results of this showed that a Pearson's R correlation found a small positive correlation between levels of empathy and negative perceptions of people who use substances. Now, this wasn't a very large positive correlation. It was only 0.28, but the p-value was less than 0.01. In our regression, we found that levels of empathy account for 7.7% of the variance in negative attitudes towards people who use substances. So while these are not large percentages by any means, we were just really interested in looking at whether there was a predictability between those levels of empathy and those negative perceptions of people who misuse substances. And even though it's not very large, it does have a positive correlation, which is very different than what we thought would occur. So what does this mean? Well, among religious and spiritual college students, there's a higher self-reported empathy in relation to higher amounts of negative attitudes towards individuals who misuse substances. Now, this was very different from previous research that we've seen, looking at religiousness and empathy levels in turn to people who, in relation to people who misuse substances. This was very different. The other ones have said that there's normally a negative correlation, but this one is a positive correlation, which we were not expecting at all. So through this, the increase in empathy may not be enough in a religious or spiritual setting, especially college student setting. That we may need to implicate education through central and logical arguments. This could be really important because even though empathy is very, very important in understanding other people and putting yourselves in their shoes to see how to understand them and help them, in this specific population, we may need to increase education rather than just focus on empathy alone. So the limitations that we had in this study was the bias of religiousness and spirituality. We did not control for this because due to our study and what our constraints were, we only did a simple regression rather than a multiple regression. And so we did not control for religiousness and spirituality, and that was on purpose. And so we later on for our future discussions, we want to see how religiousness and spirituality impact that specific viewpoint, and how, because it can have a very significant impact as we can see through our hypothesis not being correct. And also we did have one issue with the construct validity. So the Stigma of Drug Users Scale, it could be measuring the views that the participants believe that the general public holds towards people who misuse substances, not their individual values. we use this one because this was the only measure that we could find during that time period that was both had high construct validity in other areas, but it may not have construct validity towards people's individual values. So there is that issue. And then also convenience sampling. It could be a possibility of a non-representative sample because this could not be representative towards the greater generalizable population. This could only maybe possibly be done to a specific, very small niche of people. But also the strength is it could be generalizable to religious college students and to people who are in our 18 to 22 age range. Because this was only done with undergraduate students, it could be generalizable to that specific one. So our future interests we want to look at is the relationship between religiousness and spirituality on levels of empathy. We want to look at the differences between a religious group and a non-religious group on their negative attitudes towards people who misuse substances and compare the two to see if they differ and be able to analyze them on that specific subject variable. And we also want to look at surveying the generalized population. So we possibly want to look at surveying this towards people who are not college students, who are not in this specific age range, and see if they hold particular and specific values that are generalizable to this. And lastly, we want to look at the correlation between socioeconomic status and cultural norms on stigmatized attitudes, because these can make a very large impact on someone's view of the world and on the view of other people around them, and how they're revealed in perspective and how they have attitudes towards this specific group. Well, that was my presentation. I hope you guys enjoyed. Thank you for listening. And if you have any questions, feel free to ask.
Thank you for another great presentation. Do the judges have any questions?
Yeah, I'll go ahead and go first this time. Thank you for your presentation. It was great. I appreciate it. I think my biggest question is, you talked about how your study could be generalizable to Christian colleges. Did you look to see if the results that you got were consistent with Baylor's population? I don't know if you have access to that data, but it would be interesting.
Yeah, so it was conducted through Baylor's population. So there wasn't any other studies that looked at these specific variables, but because we did look at those specific students, I would think that it would be generalizable to Baylor's general, because we tried to get a equal amount of a representative sample of freshmen, sophomores, juniors, seniors, to try and see if it was generalizable. And I would hope to say it would be generalizable, but hopefully that can maybe bring more opportunities to bring more empathy and education towards these students.
Great.
So I have a question about this online survey that you used. How was it disseminated? Was it sent through classes? Did you just post it on social media? How were you able to get that out to the people that used it?
Yeah, so we sent it through emails to students. We also put it up around different buildings, like a sheet with a QR code. And we also did it to people that we knew, and we had, said, hey, can you please send it towards 2 people that you know, and to have it like that kind of snowball effect, kind of like snowball sampling as well, but mainly convenient sampling out of mainly through like emails and mass emails to people in different classes and different schools, things like that.
Great, thank you.
Thank you for your question, judges. We do have to move on to the next presentation now. So our last presentation is by Lydia from Baylor University. So Lydia, you can share your screen and begin whenever you're ready.
All right. Share my screen with you guys.
Can you guys see it all right? Okay. So hi guys, my name is Lydia Yan, and I am a Baylor student, senior. I am double majoring in economics and marketing. And today I'm going to talk about the beauty dictator game. And this paper is for my honors thesis, and it's under Dr. Jason Imany's supervision. Okay, so here is an overview of my presentation. So since my experiment requires human subjects, we have to have the IRB approval, and we just got that earlier this week. And so we'll have our data shortly, probably next week. So I'm looking forward to collecting the data. So here's my proposal. So as we move into this digital era, we are more media as a way of communicating and reach out to people and socializing. And so research have shown that a market paper says that the plastic surgery surgeons, do you see a surge of the demand from women for plastic surgeries? And now, as with COVID, we're moving toward another form from online communicating to online conferencing. So now we have this, we're only seeing each other's faces. So which makes our, the way that we present ourselves restricted to the upper body. So most importantly, the facial attractiveness. So this is my paper is that as economists, we like to put a price tag on different occasions. So now we're trying to see what is the price tag for people's facial attractiveness. And specifically for this paper, I'm going to study about how people, what's the people's willingness to pay as a way that they perceive other people's facial attractiveness. So here is some past research in different fields on this topic. So in biology, that there is consistent literature shows that adults share a consistent preference over facial attractiveness. And especially for women, since during the social interaction, that women during the mating process are more emphasized on facial attractiveness because of the signal of health and youth. And for men, it's less salient, but it's also very important because for men during the mating process, it's more about resources. But this paper in this literature shows that adults share a consistent preference over facial attractiveness based on those two criteria that I just shared. And they also found that this preference does not only apply to the Western standard, but also to the Eastern standard. And specifically, they found out that when people rate subjects or targets facial attractiveness, they found a high correlation. I think it was 76% of people agree on who are attractive and who are not. And that's a big correlation between people's beauty standard. We always think that, at least for me, before I did this research, I always think that beauty is subjective, but according to this evolutionary psychology, that we do have a lot of common criteria, and we do have this biological needs and evolutionary needs to, I guess, rank people. So in this psychology literature, that people found first impressions based on facial attractiveness does not only apply to the first 10 seconds that they see each other, but also have a long lasting effect. And especially even with kids and children, research have shown that good looking children tend to have more attention from their parents as a result of their facial cuteness. Yeah, that's very surprising. And yeah, so people like to associate beautiful people with positive qualities. So some of the qualities, especially qualities that are related to social interaction, so such like kindness, friendliness, generosity, and warmth. So there is this effect called "what is beautiful is good," And that's when people like to associate these good qualities with beautiful people. And then this effect does not only apply to psychological and biological needs, but also applies to the business world. So in this case, that in the financial market, when this researcher from, I think from national, I can't remember the exactly name, but it's from a macro perspective, that in this financial market, that well-experienced lenders are tend to use statistical reference to categorize the reliability of borrowers. Unexperienced lenders are more likely to apply taste-based discrimination to borrowers. So they will have, they'll give a lower borrowing rate for participants who have a higher facial attractiveness. This also applies to the labor market. Well, so beautiful employees are more likely to receive beauty premium, while plain looking employees face beauty penalty. But however, this research have some adaptation, as we can tell it's done a long time ago. It's done in 1993 as the beauty premium was first introduced. After that, a lot of a plethora of research has done studying which criteria does beauty premium have the effect, and which criteria does the beauty premium have not the effect. So this is one of the papers that says that because people have this higher standards, almost they're attributing positive qualities to beautiful people, they're also having higher expectation out of their performance. So there's this reverse effect when employers receive the employee performance when the beautiful or the good-looking employees are not meeting that expectation. So there's that reverse effect. So here is my methodology for my research. So I'm very thankful that Dr. Axway from A&M shared her data set with me. So what she did is that she did an in-person experiment with dictator games. And basically a dictator game is you give participants an envelope of a fixed amount of money, and they can split that amount of money between themselves and a second player. So basically, and there's no restriction and there's no guidance on how they should allocate the money. So by studying the allocation amount can show the dictators about their generosity. So in this paper that she found out, she used envelopes with dictators' faces on it, and they had the recipients of the envelopes to decide which envelope they would like to receive. So the rational behavior for these recipients is to decide which envelope owners had the greatest generosity, so that they can, in return, they can receive more money. So what she found is that people did not actually use facial attractiveness to make their decisions, but instead they used the perceived reliability to make the decisions. So in my paper, I am using facial attractiveness as a salient factor to see if I'm making this information as the only information that my recipients are getting, how would that impact their decisions? So I'm still using $15 as the total allocation amount, and trying to see how people perceive whether the dictators are generous or selfish. So this is my hypothesis, that I still think that what is beautiful is good. It's gonna take part in my paper, and I'm going to study this in two criteria. One is the absolute beauty premium. That suggests that whatever gender group you're in, that if you are perceived as more facially attractive, you're gonna have this beauty premium. And versus the second criteria,
as the relative beauty premium, which suggests that if attractive dictators are shown after unattractive dictators, as the participants have this anchor point, they will perceive the attractive dictators as more generous in response of their the anchor point. So here is a clip of my survey questions. So basically I'm studying is I'm giving out the rankings from a group of independent raters who rate the dictator's facial attractiveness. And according to the previous literature, that since people have this high correlation of who is attractive and who is not, we can assume, I'm just gonna assume in my paper that this independent ranking is gonna be objective. So here is the 4 criteria, which is attractive men, attractive women, unattractive men, and unattractive women. And during the survey, the order of the questions will be randomized, so I can see the relative beauty premium effect in this paper. Yeah, so thank you guys for listening, and are there any questions?
Thank you for a great presentation. Are there any questions from the judges?
Yeah, this is so interesting. I guess my question is, how are you going to choose your population that you're going to, like, what is the data collection method going to look like? Do you know that yet?
Yeah, so so for economics experiments, we are incentivize people by cash. So I'm piggy banking on my advisor's co-author. He's doing in-person experiment as well. So my experiment will be posted after his. So I think what they're doing is they're just going to distribute it to their like sample pool. I don't know exactly who are in this sample collection, but I will have their demographics and other information collected in the end. So I'll be better to answer you after the data collection.
Yeah, that's great. Thank you.
Yeah, I'm just sort of processing all the information you gave. I've never actually heard of this dictator game experiment before, so that's really interesting to me. Do you have, in more of an implementation sense, do you have sort of a timeline? Do you know, are you going to write this up as a manuscript? You said this is your honors thesis, correct?
Yes.
So are you sure how this is going to, like your timeline, how this is going to play out?
Yeah, so already, so right now I'm trying to work on the code so that when the data does arrive, I can immediately apply the codes to my data, and then hopefully the data analysis will be fast. But yeah, I've already written down like the literature review and the methodology chapters. So I'm just waiting on the data right now.
Great. It sounds like you've got it all set up. You're just waiting on the actual process. Good.
Thank you.
Thank you. Thank you to all the presenters. You did a wonderful job today. This concludes the Public Health and Psychology 1 division. We're going to take a picture of everyone involved in the division for social media. So if you can, please turn on your cameras if you'd like to be in it. Okay. 1, 2, 3, smile. Okay, thank you. And judges, please stay on the Zoom to review comments and deliberate. Awards will be announced after the keynote speech today, and feedback will be emailed after the conference is over. The next event is the graduate school fair, so you can now leave the Zoom call and refer to that program and the Zoom links on the Burst website to find the link to the fair.